I'm going to change the
Okay.
presenter to you, and then you'll be able to bring up your PowerPoint. This is just our introduction.
The title page, great. Okay.
Yep.
No
Let me make you the presenter and let me know that you see that, and then you can take right over.
Show my screen. Yep.
Thanks, Dave, for coming on today and joining us. We really appreciate it.
Of course. Do you guys see?
We get lots and lots of questions about ACA, and I am not the guru like you are. So
I'm not a guru at all, but definitely I've been doing it for a while. So if I don't have answers, I'll definitely get them for anybody who asks something I don't know. But this is a good little brief intro 101. Do you guys see my screen, ACA Myths and Concerns webinar? The pinnacle?
I can see it. I can see it.
Perfect. Awesome. All right, let me make it full screen. Okay. Yeah, so like I said, thank you so much, guys, for having me. I've hosted a couple of webinars. I've been with Pinnacle since December. I've done a webinar a month pretty much. Very, very basic 101s. I have links if you guys need them to those. This is the third one I've done, Myths and Concerns, because I've gotten a lot of questions from a lot of agents that have been around a while, that have been doing ACA, that have never done ACA before. So it can seem complicated and overwhelming, but ACA is pretty basic when you really break it down. But let's just start and get into it. You guys ask any questions you like, and again, Stephanie will help and monitor those and ask anything you need. Okay.
So I'm keeping an eye on the chat.
All right. Too complicated and overwhelming. False. These are not government health insurance plans. Some people have thought that before. I've had that. These are provided by the government, almost like Medicare, but it's not. These are actually private insurance companies: Blue Cross Blue Shield, Ambetter, Molina, Oscar, CareSource, Christus, some of which are only ACA, right? Some insurance carriers don't do anything else but ACA. So these are private insurance carriers that the premiums are just being subsidized by the government if the person qualifies based on their income. And that was the main focus of ACA was income. When it was brought into place, it was for the middle to low income, right? These are people that made too much money to qualify for Medicaid, but not enough money to afford $1,500 for a private plan on their own, not through a job or something, right? So the applications are simplified even further if you compare them to a Medicare app. One of the few differences are the tax implications. This can get tricky, but that's the only thing really. So if the conversation does get confusing with any consumers, right, customers, this is something you'd always direct them to seek clarity on from a tax professional. So the basics of the taxes, you have to claim a certain amount of money. You have to basically predict how much money you're going to make that year for the coverage year. Okay, so on the phone right now with somebody, they tell me they're going to make $20,000 this year by December, and it's basically a prediction. They're going to get X amount of dollars in subsidy from the government. They're going to say, the government's going to say, okay, you don't make enough, we're going to help you get this health insurance. Great. They end up making $70,000 by December. If they never report and nothing ever changes on their application, and they get the insurance and they have the coverage all year, by tax season of next year, right, for this tax year season, for this coverage year, they are going to get hit with a tax penalty because they only told us they were making 20, they actually made 70. They didn't need as much help as they said they would from the government, so the government is going to take it back at tax season. But it also works the other way around. If they make 70, they tell us 70, and they actually make 20, they're actually going to get a tax credit in their tax during tax season. So, but again, though, when it gets choppy, seriously, just talk to your tax professional. As long as they're reporting to you throughout, like if their income changes dramatically 3 months in, 4 months in, as long as they let you know and you report it, then everyone's good. Great. My clients must register themselves for coverage to the federal marketplace. This is what I think might get some people scared or overwhelmed. When federal marketplace, federally facilitated marketplace trading, there's so many things that have to do with the federal government. Yes, because the federal government is the government who is helping these these people, right, with their healthcare. So they can do that. Okay, so healthcare.gov, that is the federal website for ACA. However, it's, again, the federal government, right? So it can get complicated and it can get hairy. So you have to, most of the time, call in and speak to a customer service agent. However, you can add value as an agent, right? You make this process much easier for them just through simply helping them navigate through another website like healthcare.gov. Now, to explain the difference, basically, healthcare.gov, the federal government, is a DE, a direct enrollment site. Health Sherpa is an EDE, so an enhanced direct enrollment site. That is the one that is highly recommended throughout the country, right? So much easier. I've done a whole webinar on how easy it is to get through that process through one application on Health Sherpa. Awesome. Their customer service is awesome. I've hardly ever had to call them for any any application related things, just for general stuff, but their customer service is excellent. So if you ever need help with the app itself, they're there for you for sure. Health Sherpa, you can write policies in about 28 states on Health Sherpa, and that is the federal exchange. Okay, so basically you want to think about the country is almost split in half with federal marketplace exchanges, right, and state private exchanges. Okay, so states like New York, New Jersey, Connecticut, Pennsylvania, I'm in Philadelphia, Pennsylvania, so we all have our own private exchange. In Pennsylvania, it's called Penny. New York is the New York State of Health, right? So those different platforms, those are for those specific states, and then you can sell all the other states all in one on Health Sherpa. So it actually does get pretty simple. So okay. I'll get back to the states and the federal in a little bit. I know that's confusing a little bit. So only clients who are very poor qualify for ACA coverage. So I was mentioning this before, but the Affordable Care Act was implemented to give Americans with lower income access to insurance plans they couldn't otherwise afford. Some even get their plans at a $0 premium. So it also gives the middle income families, like I said before, low and middle, the opportunity to pay far less in premium they would for a private healthcare plan. So just to break this down a bit, again, the government is subsidizing. So they're just basically giving you or paying the insurance company what you need. So that could be all of it, or it could be just part of it, depending on how much you make, right? And there's a whole income chart we'll get to in a bit. But the more you make, the less subsidy you get, the less you make, the more. So some people can qualify for a $0 premium, which is a huge selling point, obviously. But the middle income families also can pay, $500 instead of $1,200 for a plan, to get through the year. So the subsidies are incredible, and they're still being talked about in Congress right now. But that's not decided on yet. So we'll stick to this for now. I can't make a lot of money as an agent selling ACA plans. So commissions are paid differently for sure than Medicare. However, the opportunity to make monthly residual income could be potentially more lucrative than a Medicare plan even. So how ACA pays out all the carriers, they pay out what's called a PMPM, per member per month. Okay, now the commissions the numbers, just hear me out, they're much lower. So let's say I'm not a Medicare expert whatsoever, but I think it's around like $600 or $700, something like that, as a commission for a Medicare plan. ACA commissions pay about between $15 up to about $35 is pretty much the split I've seen. So on average, say it's $25 a person, but it's per member per month. So now you get a family of 4, and now it's $25 per person per month. So it's $100 a month. Every single month, though, that money comes in. You get that commission every month. It's not a yearly check. It's you get that money every month. So now you're getting $100 a month for the year, as long as they keep the plan active. It's $1,200. So right there, it could be definitely more lucrative than Medicare if you look at it that way. And you'll get that income as long as the plan stays active. The other part of it too is that a Medicare phone call, which I'm sure you guys know, could be, I used to do Medicare a long time ago. I mean, I had 2-hour phone calls, easy. 20 minutes to half hour with ACA, 20 minutes to a half hour. So you can help more people in the same day that you can help the amount of people you can help with Medicare. So both things add up, it could be more lucrative. Okay, this one, if no one's been around ACA for a while, you might, this is kind of moot, but because they really put a lot of things into place. So back in the day, I mean, a year and a half, 2 years ago, it was easy for another agent to just go in to, especially Health Sherpa, to steal a policy. You know, I ran a call center and I had agents selling policies, and 10 minutes later, they would get an email saying, hey, and then they would call me, my policy is being stolen right now. Like, because you can see that in Health Sherpa, they actually send you notes on that. So, and it was legit. They were actually able to do that. Just bad actors out there were just going in, just changing agent of record. If you heard that, it, again, was not a rumor, but it's not happening anymore. They put a lot of roadblocks in place for that, and preventions. So ACA regulations are catching up to Medicare. Obviously, we're nowhere near Medicare in regulations, but they're getting there. But they have at least put things in effect that is going to avoid this. So it was like 2023 to 24 new rules are put in place by cms.gov, and it'll avoid these situations moving forward. So, and I haven't heard much since. Now, for the state exchanges, the state things are pretty much the same. Now they have more even more rules in place too. Stephanie, I'm just going to pause there. Does anybody have any questions yet?
It's a bad place to pause because my dogs just started barking. There are some questions. Hang on a second.
Let me see. I can check it out. I can see it. I can see it. Sorry.
Sorry, I had to regulate for a minute there. Give me 1 second.
No, no problem. I thought I could see
Okay.
it. Maybe I
Does
can't.
Pinnacle provide overrides for ACA plans sold on the Anthem platform?
Yes, depending on the state. Like, so, for instance, like New York, we don't even deal in New York. But you know, they have non-commissionable plans and such like that. But Anthem, absolutely, yes, we do. And I don't know if anybody realizes, but we partner with a company called Agility, and they are our ACA partner. So, and they are in, I believe, every state, but maybe not even New York. So, but yes, other than New York and some, if there's any non-commissionable, we don't, obviously Anthem doesn't pay out, but if Anthem pays, and then Agility, and we do pay for sure.
That was the only question so far.
Okay, great. All right, so let's, yep. All right. Too difficult to get certified to sell ACA plans. False. So, all an agent needs. So number one, your state license. So your resident state license, obviously you have your health license. It's your health and life license, the same license that you use for Medicare, for life insurance. So whatever that license is, you have it in your resident state, so you can absolutely sell ACA in your resident state. And then any non-resident states that you get, you can also certify there as well. So this kind of gets back into the split between state and the federal exchange. So the marketplace, again, healthcare.gov, the federal exchange, also Health Sherpa, which is what we recommend. You can do about 28 states there on there. 20 states right now are private. They have their own private exchanges. Okay, they have more control over it, right? So they decided to go private. So for the federal exchanges, let's start there. All you need, again, number one, your state license. Now you go to cms.gov. I'm sure you guys have an account already because, you know, for Medicare, or if you ever needed marks access, right? CMS.gov, you set up, you go and look for your federally facilitated marketplace training, your FFM, okay? Now, if you've never taken it before, if you've never seen anything ACA before, it'll take about 2 to 3 hours, unlimited attempts to pass, but it's not difficult. And then you get your certification, and now you have your FFM certification for that year. That allows you to create an account on Health Sherpa and go right ahead and sell in 28 states if you have those state licenses. Okay, now that's your training right there. But if you want to sell on a private exchange like Pennsylvania, New Jersey, Connecticut, those have those private exchanges that you do actually need to take a separate certification for, just to be able to sell on their platform or write policies on their platform. Time, it does take some time, right? So it is a bit of that, but it's free. Everything is free with ACA. Nothing has cost you money. Anthem maybe with contracting and appointing, but it's very little, and that's literally it. But to take any of these courses on Get Covered New Jersey, you take a bunch of modules and you take a test. Most of them are like the FFM unlimited tries. New York, actually, which I did do myself, that was the only one I hit that actually gave you only 2 attempts to try and pass. But other than that, once you've taken one, you're pretty much taken them all. So you do get to, it does go faster as you take more and more of them. However, not to say don't pay attention to them, because there are different regulations for some of the states, slight stuff that does change from state to state. For instance, Connecticut, you don't even get the access to the modules and the training to sell on their site before getting contracted and appointed with the actual carriers that you can write policies for on that platform. So it was just funny. You have to get contracted and appointed first, and then you get access to the training site to certify to write policies on the Connecticut private exchange. So again, that does get confusing, and I get it, but it's just a time suck. But that's it. It doesn't cost you anything, and it's just it goes fast as you move along now. All right. We can only enroll consumers during the open enrollment period. So false, of course. So this is almost exactly like Medicare, right? And I know you guys are very well versed in this. You know, the consumer must actually qualify for an SEP, or, you know, they must have a QLE, right? Right now, there's about 19 different life events that would make them eligible. So I want to discuss one major change that it's actually proposed. It's not actual law yet, but with ACA, a big part was a big reason that people were able to sign up all year long was that they were allowing an income SEP to be a QLE, to be a qualifying life event. So every month, as long as someone met the criteria for the income level that would get them a subsidy, they could literally change plans every single month. They're proposing to take that away, but it's pretty much out there. We're just waiting. We don't have an effective date on this yet, but that is coming. That they're taking it away. They're taking away that income SEP. So income qualifying consumers would only be able to enroll during open enrollment. So that's the biggest change recently, but there's others on the horizon. But again, still no effective dates.
Dave, there's a few more questions if you want to take
sure.
a break, or do you want to wait till the end?
Yeah, no, we can go ahead. Let's
Okay.
hear.
The next question was, how do you get a carrier bonus?
So Pinnacle and ACA, we honor those 100%. So if there are carrier bonuses, we track that. We have CRM. We have our own CRM that tracks it. I don't know if most of you are aware of BOSS, back office support system. So that's our CRM at Pinnacle. Agility actually has their own. So we track those. We actually had a few agents and an agency actually come over to us because their last one wasn't giving bonuses or tracking that for them at all. So as long as the carrier does do bonuses and for certain thresholds, certain production, then we absolutely honor that as well. It goes right to you. That we don't take a chunk of it either. Neither does Agility.
Perfect. Okay. And then are any of your represented plans available in New York?
No. Yeah, like I was saying before, New York, if you look on the Pinnacle website and are under the ACA tab under products, you scroll to the bottom, you can see, the United States map, and you hover over each state, and that'll tell you all the carriers that we can help you get contracted and appointed with. But then there are 4 or 5 states that are just there's nothing. We that are grayed out. New York is one of them. So we do not operate ACA. We don't sell ACA. We don't do anything with ACA in New York, unfortunately.
The next one, I'm not sure I understand the question, but it says, do you know if there is a move from FFM to state exchanges in the future?
So when it started, I'm gonna assume, so ACA started in actually 2006, 2008, not officially. It was in Massachusetts. It was actually called Romney Care. That was their senator then, and he's the one that put it in place actually. But that built the framework. So in 2010 is when Obama put it in effect, lawfully. So they used that as the framework though to build it. When it started, the reason I'm going back in history a bit is because it was all federal at that point. Well, Massachusetts obviously had their own already, but pretty much every state was on the federal exchange. As years went by, more and more. So now it's up to 20. So just looking at the pattern, maybe, and absolutely. So for instance, Georgia was, I think, the most recent one. They were always federal. You could always sell them on Health Sherpa, healthcare.gov, Health Sherpa. And then Georgia just went private, I think last year. 2024, I believe they were private. However, Georgia is actually, because they were on Health Sherpa for so long, you could actually use Health Sherpa still, even today, to write a Georgia policy. So yes, it looks like more and more are doing it. I don't know if all states will eventually, but possibly. I don't know, whatever is on the horizon for ACA, we're going to find out soon enough. Which is this next slide, and we'll talk about. But was there any other question there, Steph?
Yeah, there's actually quite a few more. Can you send out something, how we go about getting certified in the private states? Do we have any documents on how to do the certification, like for New York specifically?
Yeah, for sure. Great question. So yeah, so I did a few, Pennsylvania, New York, New Jersey, and Connecticut. Well, Connecticut I didn't finish because I had to get contracted and appointed first, and I didn't do. But I have my own little instructions I can send out, but also Agility, which is in every state. They actually have on their webpage guides and instructions on and links to each and every private exchange, all 20. So yes, we have all those resources for you whenever you need it. And I'm always available to call me. I can walk you through stuff, anything you need.
Okay. Does Pinnacle have a cheat sheet for ACA brokers process for New Jersey and PA? So that's just what you just answered. So it's pretty much the same question.
Yep.
And you said, is the income SEP still currently going? You said they're working on that?
It is right now. Right now, it's still allowed. And again, it is their number one proposed change, but again, no actual effective date as of right now. So we're just going to keep going until they take it away.
Okay. And someone is asking if you can go over the other SEPs to be able to write people. I don't know if that's in your presentation or if that's a different thing, but that was one of the questions. And then this one is, if Anthem is paying $18 per person commission, does it change under Pinnacle?
No. So back to what you just asked just before that with the QLEs and SEPs. So it's almost the I don't know for sure. I haven't actually done it side by side, but it's almost just from what I know from selling and managing ACA teams, almost mirrors QLEs in Medicare, almost. Having a baby, having a divorce, getting a divorce, getting married, adopting a baby, getting out of prison. There's 19, like I said before, and cms.gov is a great source. Whoever asked that question, or I can send it to you, Stephanie. I can send you some links after this, 100%, to really make sure you know exactly what those QLEs are.
That'd be great. And then we'll
yeah.
send it out when we send out the recording.
Sure.
So whatever
Sure.
resources you want to send me, that'd be perfect.
Awesome. Okay. And then as far as the PMPM, good question. The commission that Anthem pays out. Any carrier, doesn't matter who it is, Anthem, Ambetter, Molina, CareSource, Christus. We don't touch the PMPM. Okay, that PMPM, the per member per month commission, the writer of the policy, the agent who wrote the policy, gets the full PMPM. That is for agents. Anyone above, then there's going to be an override system, right? There's going to be an override contract. So I'm not sure exactly who and where everybody lands in the downlines and uplines here, but one agent writing the policy, their upline immediately will get a contract from us before we start. It comes from Agility, but we're the same, we're partners. So then contracts for the overrides will get split, either 80-20, 60-40, 40-60, vice, and so on. So the agent gets full commission always, and then the overrides get split on the uplines.
Okay, and then this last one, it says Medicare commissions are under attack by the carriers. Do you see the similar situation happening in the ACA space?
So it's a good segue to this slide we have up now here. So I'm sure most people have seen this administration has never been so super keen on ACA, right? Now, there have been changes for sure, and I'll just read this. He's made public remarks for years that he wants to do away with it. Whatever happens, it's so deeply ingrained in our healthcare system. I mean, you got Medicaid involved, Medicare, the applications, when you are on any of these platforms, they actually will tell you in the beginning, you input income, you input, the questions that they ask, you type those in, and it'll tell you whether they would be referred to Medicare, whether they should be, or they will be referred to Medicaid. And that can happen directly from your screen. Basically, when you're signing them up and it gives you that message, that platform is going to send a notification to Medicaid, and then they'll take it from there. Or obviously, you put someone in at 66 and has Medicare or needs Medicare, then they're going to get notified as well. So it's so deeply ingrained. And again, just the Medicaid system, there's so many tentacles in our whole country over it. It would take a long time to get rid of it. And again, obviously, I'm sure everyone's seen, he's never had an actual plan for a replacement, but they're doing whatever they can to kind of draw back on it. So again, it would take a very long time to unwind the entire thing. So until then, it's still a good idea to have this in your tool belt and offer it and make some money on it and help as many people as you can before anything like that happens. But again, it's going to be a long time. So really, it's not something to worry about at this point. When I made this slide before that SEP change, that's the most major significant change, proposed change, but the most significant actual change, and it is effective already, was reducing funding for ACA had what they called employee assistance programs, not employees, excuse me, I'm sorry, agent assistance programs, where they would pay out extra money to navigators or assistors. They couldn't write a plan, so it actually doesn't affect agents. That's my point here. It actually opens up a little bit more room for us as agents to write more plans, because they've gotten rid of the navigator programs. They basically just navigate them. They basically do your job. They do everything you do with them that you would do with them, and then send them off to healthcare.gov. And then they just basically either do a three-way call and the consumer says, yep, that's what I want, and they're signed up. They pretty much, they stripped 98 million a year from that program. They didn't shut it down completely, but it was something like that. So people, it really just hurt people more than it hurt us, which it's not funny, but it didn't hurt the agents is what I'm trying to say. Just more work for the agents, which is good. More work, more commissions. So as long as you can get to those people, then it's okay that they didn't have that navigator program, because again, healthcare.gov can get super complicated anyway. So you help them through Health Sherpa or your state site, and you're good to go. Yeah. Okay, I hope that made sense.
Yes, no, it made sense. There's a couple more questions. Do you want to wait until the end for the rest of them so you can get through your presentation?
Let's go. All right, let me just show you this. This is that income chart I was talking about before. These were the numbers for 2025. So 2024 and 2025, I think. So if you look, okay, it's cut off a little bit on the left, guys. Sorry about that. But persons in the household, in the family or the household, okay? Now, one tricky thing about ACA, when you're doing the application, this goes back to the tax implications. People have to report to you when you talk to them about their income, but not only their income, their tax household income. Okay, so whoever is on their tax return, if they're claiming a dependent, if it's a husband and wife, and they have to file jointly, right? To receive an ACA plan, to receive a subsidy for an ACA plan, right? That's the important bit. To be able to be eligible for a subsidy, if they are a married couple, they have to file jointly. Okay, but let's just go back a minute. So it's one person. You get one person on the phone. They're single. They have no kids, nothing else. They have one person. They do their own tax return. They make $20,000 even. Okay, you see right there, 20,783 is the limit for a single person. So that is the number they're looking for on that tax return, right? So if that person made 30,000 by the end of the year on their tax return, they're going to get a penalty. If they made 19, they may get a slight little bit of credit. Okay, as the family members go up, right? 1, 2. Now, one slightly different situation. You have a married couple and one child. Okay, the wife, let's say, gets insurance at work. The only person on the phone with you that needs health coverage is the husband, and they have a child. So that tax household, you're actually putting in for 3 people. It's a 3-person household because there's 3 people on their tax return. Their income also matters. The wife's income also matters because it's a tax household. So even though the wife is not getting coverage and she's not going to be on this ACA healthcare plan, her income still needs to be included. So that might be a situation where they won't qualify for a $0 premium, but they may qualify for a subsidy of some sort. So again, that's again, like I said in the first frame, tax implications can get tricky, but just remember, when you're claiming income on an application, it has to be the full household income, even if people are not getting covered in that household. As long as they're on the tax return, they have to be included in the income. Okay, so this is your chart, and again, I could obviously, well, you have it in this, so you can send this out. You could always use this chart, but this is basically where you're always gonna use this resource when you're talking with someone. And the nice thing is too, like Health Sherpa, even the state exchanges will also provide this too. They do it for you. They do the math for you. Basically, you don't have to have this up and look at it while you're writing a policy. You put in their income and it'll tell you right away, oh, that's too much money. Okay, they qualify for 200 in subsidy. They don't qualify. They probably qualify for Medicaid, whatever. So they pretty much do it for you, but this is a good resource and reference for you. What was that? Did that answer that last question, Stephanie? Sorry, what was the?
I'm sorry, that the last question that I asked you was about the commissions being under attack. So you had already answered that.
Oh,
There's a
right.
couple of other ones in here though.
Yeah.
Does using Health Sherpa prohibit the lead process for the federal exchange?
Does you prohibit the lead process? I'm not sure what that means.
Yeah, I don't, that's what it says. Does using Health
So,
Sherpa prohibit the lead process for the federal exchange?
uh,
With the
yeah,
lead process for the
if they
federal
can
exchange?
clarify that when they can. But I mean, as far
Mhm.
as lead programs, so well, okay, so the state exchanges and even Health Sherpa, once you create an account on Health Sherpa, you can you qualify to get on a list for them. So if an individual, just a client, just is jumping online, they can actually look up a list. And if they go onto Health Sherpa, they can see available agents in the States. And you can do the same thing in on the private exchanges as well. If you make yourself available on those public um, agents that are available, then you will show up. I don't know how exactly those work, whether you show up at the top of the list, whether you show up at the bottom, they have to search for you. So just like Medicare, there's tons of lead programs as well that Pinnacle can provide. We have lead programs. I know Lead Star is a big one that we use.
Mhm.
That again, we can provide discounts for stuff like that. People use Facebook now, social media, tons of ways. The same ways you're advertising for Medicare as an agent, same thing goes for ACA.
Right. Okay. I think that answered the question. Can you talk about the family glitch? I don't know what that is.
Family glitch.
Maybe they were referring to the fact that everybody's income has to be counted, even though only one person's getting insured.
That could be it. Let me see. Let's see what that. Hold on one second.
Yeah, no problem. Thank you.
That might have to do with like the children. Like, so you put the income in, the child is too young, they might qualify, be eligible for Medicaid, so their application gets referred, but the parent still qualifies. So- oh, actually, wait, this might actually be in reference to work. Okay, so this this does get into another one, a little complication with work. So a lot of jobs out there, a lot of employers obviously offer health insurance. Some may provide it at too much of a cost, though. So even the employee contribution can be too much. Now, when the math shakes out, if the employer, so someone has a full-time job, but the employer is charging, if the employer is charging more, now I got to check this number, but I believe 2025 it's around 8.9%. If the employer is charging the employee more than 8.9% of their salary, then they are eligible for an ACA plan. This, however, gets choppy though. And I just keep an eye out for it, guys, because a lot of people that ACA, the demographic it's shooting for, a lot of people when I was selling plans don't really know exactly how much money they make, whether they're a 1099, even a W-2 employee. Some didn't really know, right, with benefits and this and that. They don't let them actually know how much they're making, let alone if the health coverage being provided by the employer is more than 8.9%, right? So it gets really choppy. You might want them to, again, talk to their either tax professional or get rock solid numbers from their HR department at work so they can know if they're eligible. Because if they don't, if that employer coverage is less than the amount, and again, 8.9 might be wrong, it's something around there, they're going to get a penalty at tax season again. So you just want to watch out for that. And there's also rules where, say it's a married couple, only the husband needs coverage. Actually, I'm sorry, both need coverage. Husband and wife need coverage. But this rule that I was just talking about, 8.9% of your salary, only applies to the single person threshold income amount, if that makes sense. So basically, if the employer offers the single health coverage, not for the family, the single person's health coverage at less than 8.9%, they can still get a penalty. So, right, so the husband calls up, says, yeah, my insurance for my job, my employer, for me and my wife, for my family, it's over $1,000, whatever it is a month. We can't afford that. But it's how much the single plan costs for them. And that's where it gets tricky. That's where it gets a little glitchy. So you just want to make sure they talk to their employer or HR, know exactly what they're making and how much the percentages of their income that the health coverage costs, if that makes sense.
Yeah, there's a couple more.
Okay. And
There's a couple more, but I'm going to let you continue on with your presentation because
yeah,
you might
pretty much
answer
done.
some of them as you go.
Yeah, well, that was it. That was it, Stephanie, right there. So, yeah, but well, let's see. It's 9.12. Sorry, I was doing some research on the side of my phone. 9.12% of their income is right. So if the employer is offering a plan, but it's more than 9.12% of their income, then they are eligible for a plan through an ACA, through ACA.
Okay, so that answers a couple of the questions on the board here. If the employer plan does not meet MEC, what documentation is required?
MEC, not an acronym I hear a lot in the ACA world. MEC, someone help me with that one?
I'm not sure what that one is.
Read the whole thing again, sorry?
It just says if employer plan does not meet MEC, what documentation is required?
I mean, if that's referring to what we were just talking
Minimum
about.
essential coverage.
Yes, okay, all right. I knew it sounded familiar. Sorry, guys. Yeah, so honestly, not much. They basically have to, if something, this is where the regulations don't really catch up to Medicare. This is one of the ways that it doesn't really catch up to Medicare. Unless there was a microscope, an audit, something like that on somebody's taxes, that's when something like that would have to be provided. When, I mean, for years now, through Health Sherpa, through everything, I could maybe do, I haven't sold in a while, I haven't written my own policies in a while, but so I could definitely check it out. But until I was, before I was done with it, there really wasn't anything. It's really just a checkbox on an application. So it really takes the onus away from you, obviously, right? So if you're on the phone, because again, just like Medicare, your calls are recorded, you have documentation. Number one, right, the client has to be honest with you, right? So either, and you're telling them the reasons they need to be honest, right? Because you're going to tell me you make 20, but you're going to make 70, you're going to get hit with a tax penalty. I'm letting you know. So same kind of thing. If they're going to lie on their application and they're going to get hit at tax season, if God forbid they have an audit or anything like that from IRS, there will be a microscope. And this, you did your job. You have a recorded conversation where the client told you, nope, that's how much money I'm going to make. That's what I'm claiming, and that's what my employer provides me. I can't afford that. That's the checkbox you check on the application, and that's it. Again, you don't have to provide anything at the time of application. And there are some things, but not that. So you finish an application and you just need to verify income. There might be something that kicks back and says, okay, these people are approved, they're eligible, just provide income, income reports or something within 90 days. So the plan can still start. They can go on that for the first of the month, the next month. And then that paperwork, whatever they're asking for, whether it's immigration paperwork or citizenship paperwork or anything that like immigration status, as long as someone's legal in the country, they can get an ACA plan. If there's some glitch in the Medicaid system or their state system, something might kick back at the end of an application saying, please provide income verification, please provide immigration status confirmation, something like that. which they usually give 90 days, depending on what document they need. 60 to 90 days typically is the response time. So that person can still start and get their health coverage on the first of the next month. But if they don't provide whatever they're asking for in 90 days, they will get dropped. So again, back to the question, something like that, minimum essential coverage. And actually, I'd like to make one point here. Minimum essential coverage would really also not just concern the amount of money that it costs an employee, but also what the plan provides, right? So, and let me, this isn't one of those slides because it hadn't been a real big question, but it's a good one because there was a reason for ACA other than income, the reason it was proposed. A lot of plans, even private insurance company before ACA, private plans they weren't required to offer the minimum essential coverage or what, and this is why I wasn't remembering it exactly, is because what it's called on most sites and healthcare.gov, the 10 essential benefits. So there must be 10 essential benefits that are part of every single plan on it. To be eligible, to be even on the ACA market, an insurance company must provide these 10 essential benefits. And I can send those out to you too, but basically preventative services, are free. They must provide preventative. A huge piece of ACA was that no insurance carrier can reject anybody for pre-existing conditions. That was one of the biggest hurdles for ACA, and that got pushed through. So that's a huge piece of it. So private insurance companies, private plans rather, before that, if you had pre-existing coverage, you're done. You're rejected. ACA, they won't allow that. So that's a huge piece of it. So those are some of those minimum essential benefits that must be on a plan. So if that comes into question about what an employer offers, then yeah, that they won't ever, I've never seen that come back and say, please provide a statement to that effect. But if it does, it's fairly easy. You can just say something like, my employer doesn't provide ambulance coverage, or there's any one of those 10 essential benefits. If they don't provide that, then you automatically qualify for an ACA plan.
Okay, so a couple other questions here. Someone asked, what is the Agility website? Would someone have access to like the trainings and all that information if they're not actually contracted through Agility with us?
Yes, they have a general for sure. There's a general and there's an admin. Let me just see. Pretty sure it's agility.com. One sec.
Sure, thank you.
Nope, not Agility. I have it saved in my tab, so I'm
No worries, we appreciate you going looking. You can probably answer this while you're searching. Do you recommend that calls be recorded for ACA sales?
Yes, 100%. I mean, well, no, not necessarily. I mean, they have multiple ways to, record. So whether if it's on the phone, yes, 100%. Definitely have the whole call recorded. So most people, well, again, I come from, call center environments where we always had, the VoIPs where it was all through a dialer, through the computer. So they were all recorded. So whatever way you can do it, yes, but you can still write plans, in person, and then there's paperwork and everything that they can sign.
Gotcha. Okay. Another question, is open enrollment shorter next year?
Hold on one second. Let me see.
Sure.
Actually, there we go. Okay, sorry. There we go. Enrollinsurance.com. That's what I thought it was, and I wasn't finding it on my phone. So this is the general. Well, the first tab I opened, that's our admin portal, but this is the general. Enrollinsurance.com, and you can see here, this is the ACA page. This is all the states they have, and every carrier within them. So yeah,
Perfect. Thanks.
Julie's site's great. Okay, what was that, Stephanie?
Somebody asked if open enrollment is going to be shorter next year.
Yeah, so that's that one's also a proposed, but it's going to be in effect before this year. They have shortened it, yes. It open enrollment changed from well, it changes from state to state, but the federal open enrollment for the federal states was always November 1st to January 15th. Some states you can go into February. New York, for instance, had a really late, I think it was January 31st. But the private exchanges, I'm not sure about those yet, but the federal for sure is only going to be from November 1st to December 15th now. They want all plans to start on January 1. So that was one impetus behind it, but also their attempts to draw back a little bit. But yes, it is a shortened period for sure. Then yeah, that'll go into effect this year for the 2026 plan year.
Okay, well, that's the end of the questions for us. Thank you. Everybody's been really interactive today. I appreciate all the questions and taking an interest in our webinar today, definitely. Dave, thank you for your time. It's really been great. Obviously, this is a topic that a lot of our agents are having questions and concerns about. If you guys take a look at your screen right now, Dave's got his information up there for you. You can reach out to him at 1-800-772-6881, extension 7707. His email is also on the screen for you. Make sure that you reach out if you have questions, because that's what he's here for. He's here to help. If you're not contracted with us for ACA, please reach out to the office and we'll get you set up right away. Dave, if you don't mind sending over your slide presentation to me and any of the resources that you mentioned, we'll get them attached to our email when we send out our blast to everybody at the end here, okay?
Yeah, absolutely. It was great being here, guys. Thanks for having me. And yeah, just like today, Wayne, if I didn't have the answer, I'll get it for you. Yeah, I'm here for you anytime. Email, call me, whatever you guys need, okay?
We appreciate you. We appreciate you very much, Dave. Thanks. I hope you have a great day. Guys, just a couple of quick things before I let everybody go and get some time back in your day. Just a few benefits for working with Crowe & Associates. You guys, most of you have been on these before, so you know. We do have our $500 monthly lead program. That's reimbursement for Medicare leads. That's not ACA, but it is for Medicare. It's $500 a month. We do offer the T65 seminar program, where we will pay half of your vendor fee for your first seminar. If you're not familiar with the program, please, by all means, reach out. It's a great way to build yourself a nice funnel of people aging into Medicare to use throughout the year. Dave mentioned it previously. I'll just mention it again. Pinnacle has created a CRM for our agents and a portal for our agencies. It's called Boss. It can really help you keep your book of business organized and give you some tools and functionality to make sure that you're really on top of things. As far as the agency portal, it helps you to stay on top of contracting for your downlines. So those couple of things there. If you want to know more about any of that, please reach out to myself, reach out to Lisa, call the Crowe office. Teal's always answering the phone with a smile. Our information's right there on the screen. If you have any questions, if you need a hand with anything, please don't ever hesitate to reach out. I want to thank everybody for taking their time with us today. We'll be sending out that email with the recording just as soon as we have all the information gathered. I hope you all have a wonderful Thursday afternoon. Thanks so much for joining us today. Have a great day.